Fantastic. So in the first lecture, I wanted to, just get us all together. What is allergic dermatitis initially, and then go one step back, because we all know it. 1-year-old Labrador comes through the door, is itchy, ears, paws, and we're thinking, allergy, come on, what else should it be? But, we always try to teach that at the RVC, but, we always need to step one step back, and we always need to think like, okay, hang on, this dog is itchy. What can cause itch? And go through this first. Allergic dermatitis is a clinical diagnosis by exclusions. So you need to exclude anything itchy first. And if then the patient is still itchy and has a certain distribution, and we'll come to this in a second, then it's likely to be allergic. And that's your clinical judgment. There is no test in the world who can tell you this dog is allergic or not. They always sold, I think up to 5-10 years ago, they always sold the allergen-specific serology as a test for allergic or not. It isn't. It's only there to help you if you want to desensitize the cases, to actually choose and pick your ingredients depending on the history and the life environment as well. And then going a bit through, kind of an allergic workup, and I'm trying to give you a bit of a red line so you can actually feed along there, and hopefully, because I know derm can be sometimes very overwhelming, and for example referral cases, to be honest, sometimes can be overwhelming as well. If you get 30 pages of history and you're like, oh my god, okay, what happened in the last 3 years, and what drugs did it have, what drugs did it not have? And you might get cases who have been pre-treated by a different practice and you see them from someone else, and you have to go through this as well. So sometimes it might be quite nice to get your red line in there and say, okay, step 1, step 2, what do I do so I'm not getting frustrated, and I can communicate it better to the owners as well, so they understand what you want to do, because they need to treat the animal. It doesn't matter what they tell you or not tell you. At the end, it's the patient we need to focus on, and then hopefully we're all less frustrated. Right, okay, so allergic dermatitis. What is allergy in itself? At the end, it's an aberrant immune system, right? It's an immune system with overshoots to normal things it gets in contact with, allergens, and then produces a high amount of IgE, so a particular antibody. And this is certainly difficult if you think about it, because it can be anything under the sun. We're trying with the animals to think in groups, and in only 3 big groups, because we know from research and experience that if we think for allergic cases only about flea bite and food and environment, and if we tackle those 3 and address them appropriately, we can actually manage these cases very, very well. So, all your owners will come and say like, ooh, I changed the washing powder, I've changed the bedding, I've done this, used different towels, blah, 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 cleaning products. They can do that, it's no problem. If they want to trial out one thing after the other, whether it works or not. But to be honest, I find that very tedious, and often you don't come to a result. It's for humans the same. If you're asthmatic, or you have, kind of allergic dermatitis yourself, they always tell you lots of things to try out and change, and it often just frustrates you. So I want you to focus more on these 3 big groups once you come to the allergic part. Tackle those, tackle them as appropriately and as deeply as you can, and you will have good management of these cases, and the owner will understand the whole thing much better as well.